care of that. Don't worry about it.
All right. And then Alvin, if you check questions in the chat, I'll answer them at the end.
I sure will. So yes, if anybody has any questions,
Awesome.
please drop them into the chat.
Okay. Good morning. I hope
The-
everybody is having an awesome day. We're midweek, and man, can you believe we're what
A
6
week away
weeks to
from Thanksgiving.
Christmas?
Yeah, a week from Thanksgiving. So, wow. Yeah.
I know. Yeah, it's this week. This year has flown by. My name is Mike Chapman. I have been like a bad penny to some of the career networking groups, having been a job seeker myself. I went off on a different path, boy, over 20 years ago now. It's amazing how time flies in a life and in a career. And I'm really blessed. You never know. But you know, a little bit about me. I have 20 years plus experience and tops in my field. I do a lot of public speaking. Prior to this, I was a present CEO in the consumer products field. Life took a different path. God had other plans for me. I became a single parent, raised two sons, got them through school and college while during job searches, I might add, and starting a new career. And I had been the one in the family that always managed personal and family pre-existing conditions through 8 corporate relocations in 6 or 7 different years. And I feel that I'm a servant leader. I can always do better, but I am one of the top 10 most connected people on LinkedIn in Dallas, Fort Worth. So if I can help you or make link with me, and if it's somebody I have a personal relationship with, I'll be more than happy to make an introduction for you. So feel free to go through my connections. Now, a little bit about me. In the 20 plus years, I've learned a lot and I've had so much fun. And it's helped me to really reinvent myself and have a great life. And you never know, in the darkest times, and job search is one of the most darkest times you can possibly have. And I've been there. You never know when that can be an opportunity. And this is a picture from BC. There's BC and AC, and that's before COVID and after COVID. At the beginning of 2014, which is when Obamacare first came through, and I won't go into, this is apolitical. I decided I was going to rebuild and paint and turn I don't know, it was like a 40-foot mobile home into a billboard and go around town and help enroll people. And to raise money for charities, I actually did an all-nighter at a Waffle House with this crazy thing out front, and raised some money for charity. I saw clients and made clients and had fun with all the denizens of Waffle House, 2 or 3 in the mornings. It is wild. It was a great experience. I don't know if my body could handle that these days, but I'm glad I did it. What I do offer is I offer expertise and advice, year-round support, and I want you to know I really care. I have empathy, and I've got 20 years of top experience, and comes at no cost. I'm an insurance broker. I represent every and all option, and I do what's in your best interest, whether you know it or not. And I'm going to talk a little bit about that. I'm also licensed in 15 states, and I offer all kinds of different insurance besides individual and group health insurance. But I don't do property, casualty, automotive, corporate insurance in terms of property and casualty, et cetera. Now, you have perhaps you are working on contract, but you have many of you have been in what I refer to as the womb of group health plans, where you choose from plan A or plan B, or maybe you don't get a choice. And then, like many relationships with employers, you start to feel that maybe things are not quite what they should be. You may get a surprise. It may be a unexpected corporate downsizing or a new boss that just says, bam, you're out of here. But usually you have inklings of when it's going to happen. And I've been there. And all of a sudden, you're without a job. You've got obligations. It could be tuition, it could be mortgage, but you have cash flow issues. Now, I'm going to talk about insurance. You have luck, okay? You have luck, and hitting a hole in one is kind of skill plus luck, but it's mainly luck, right? Well, insurance is designed to cover risk. And there's actually a company in Frisco by the name of Advantage Hole in One that will help nonprofits. If you have ever participated, or if you're a masochist and play golf, I gave up that because I was taking out my frustrations on the course, but also slowing the play down of my friends. But if you have ever been involved in a hole-in-one contest where you pay $100 or something for a good cause, and you get to see if you can hit a hole one, well, that risk of that nonprofit having to pay out is covered by an insurance plan that the Advantage Hole-in-One offers. And most insurance types will reduce risk for a set price. And that's what you have with automotive, home, mortgage, travel. But health insurance is totally different. It reduces some financial risk at a crazy price. And it's the most regulated, legislated, subsidized, and taxed entity that you could think of. And the rules are constantly changed. But also, there's no guarantee that if you pay it, there's no guarantee of health or access to healthcare. Now, U.S. healthcare is totally different than other types of insurance. It reduces some risk, as I mentioned, but it's necessary to access healthcare, and even more so in the future. I'll explain why that's important. First of all, from a macroeconomic standpoint, this is from Kaiser Foundation. In 2020, and that was, again, 3 years ago, this country spent $4.1 trillion on healthcare. That's more than the defense budget, and it works out to $12,530 per capita, and it's probably closer to 13.2, and over 20% of our gross domestic product now as a nation because of inflation. But it is crazy expensive. So I want to talk first, before we get into insurance, what can you do about healthcare, and then what can you do about insurance? And this is something people don't think about, and that's how do you reduce your financial and health risk? And in the future, you're going to have to be able to assure your access to health care. Now, there's some things you can control and some you can't. I'm going to go through those quickly. At least for the time being, the best way of getting health insurance coverage is to find a great job with a great employer. And I know you're working on that, okay? But to do that, you have to look at one of the things in sales and being self-employed, you have to realize your return on your time invested. And as a job seeker, that's so important. You have to stay focused. You have to stay positive at all times. If you don't come across positive in a job interview, you're going to be out there on the street for a long time. And I've been there. I'm talking as a former job seeker. And you have to stay active, not only in the job search, but physically active. And you have to stay connected with friends, family, and colleagues and neighbors. It's so important, not only for your sake, but for the sake of the family and the friends and the neighbors. Now, you may have heard of a guy called Archimedes back in grade school or high school. He was a philosopher par excellence. He brought across the point of leverage, okay? And his motto, give me a place to stand on and I will move the earth. And the point is, tiny little changes in your life can make a huge difference, not only now, but down the road. This is your time to really focus on getting your BMI under control, lose weight, keep mentally sharp. I am blessed that I have a career/lifestyle that keeps me super mentally sharp. And you need to increase your physical activity and be present in the moment with yourself, with your spouse, if you're married, with your friends and family, and make it a point of making 3 calls a day. George W. Used to make a habit of writing 4 letters, 4 little notes to people he knew every day. Less likely to be able to do that. But if you make 3 calls a day, it will so improve your attitude, and it will also, you never know how that call will have an impact on somebody you know. So again, leverage. Give me a place to stand on, and we can move the earth. And a third thing, and I'm going to get on a soapbox for a second. As a job seeker with possibly cash flow that is not what you would hope it to be, you have to be thinking about how much can you afford to risk versus how much you can afford to spend. And I want to tell you, I can relate so many stories of adults who let their college age or 20-something children make their own health decisions. And guess what? They think they're bulletproof. And so they scrimp and cheat and find the cheapest thing that's available. And you may be married to an adult child, okay? So all I can say is don't let cheap friends make healthcare decisions, because it can come back and bite them. Life happens. And if you do buy it, use it, for goodness sake. There's so many wellness benefits and diagnoses that are available at no cost through health plans, whether it's individual or group health plan. Don't use the excuse and don't accept the excuse of a spouse that they don't have time or they don't want to get a colonoscopy, man, or a mammogram pap smear. These are no-cost benefits that are embedded in the plan that you're paying for, so use it. And the fourth thing, last soapbox thing here, is don't be too proud to ask for help. You don't know what you don't know about healthcare, and what you don't know could put your family at risk. So do what you do best, and that's your skills, your talents, and focus on your job search. And also be very suspicious of opinions masquerading as advice from friends and neighbors and colleagues. And don't be too proud to ask for help. Also, longevity. Changes, and this goes back to Archimedes, tiny little changes you make today can make such a difference in what your life is going to be like at age 70, 80, or 90. We have all these benefits that are wellness benefits. Use them. 80% of the health expenses of this nation that I mentioned, the 20% of GDP, are lifestyle related. You have to be accountable, and more so in the future. And the Stoics motto of a life lived well is long enough, and a life not lived well in your 70s, 80s, and 90s is not a good life. You don't want to be there. Let me tell you. Now, there's some things that you can't control, but you got to know about it. And this I'm going to mention first. First of all, you may not be aware of this, but 40% of doctors and a greater percentage of nurses are going to retire in the next 4 years. They're baby boomer doctors. Maybe they're burnout from COVID, but they aren't going to be replaced. And we can't continue to count on importing doctors and nurses from other countries. That well is run dry. So what's happened? You're going to continue to see the dilution of care and technology band-aids, telemedicine, retail clinics, And that's all the more reason to take care of yourself and get early diagnosis. You have to be accountable for your own health, because your opportunity to actually see and engage in a doctor one-on-one, mano a mano, is going to be even more diminished in the future. We should have doubled the number of medical schools or tripled them. The baby boom generation, it's like Python swallowing a pig. We knew about this, but it didn't happen. The other thing is that the baby boomer generation is getting older. By 2030, 17 years from now, there will be over 71 million people over the age of 65, and a lot more demands on our healthcare system than there is now. More demand, fewer doctors, more rationing of care, and more acceptance of triage, which is what happens in every other country. The care will go to those that are most likely to live, not those that are in their 70s, 80s, and 90s with significant health conditions. Also, of those over 65, 70% of them aren't going to be able to afford housing and medical care. So mathematically, it is impossible to sustain 20% of gross domestic product with an aging workforce. So inflation, and the inflation in healthcare is the worst in our economy. It hits fixed and low income people the worst. So what's going to happen, you're going to see fewer employers offering group health plans. It's already happened, but it's going to accelerate. And the HMO model, which rations healthcare, is going to continue to grow. You may have been in that womb, that nurturing womb of having a PPO plan through an employer with, what you thought was a high deductible, and it's going to change significantly. You're going to be required to either go to a clinic, telemedicine to see a nurse, or somebody has gone through a course, and then they jump through those hoops in order to see a specialist. So what can you do? So I want to paint a picture that may sound negative, but it is happening every day. I'm sure many of you have found that your doctor has retired or moved on, especially primary care physicians. So I want you to remember, you got to get out in front of this. Don't get stuck in the good old days. You have to budget and rethink your financial plan. And financial advisors, they can't, if they know about it, their errors and omissions insurance, they can't talk about this. So the point is, if you're living in a mansion, whether it's in Southlake or Plano or Frisco, or just an overinflated house in Dallas or Fort Worth, you have to think about, what are you spending your money on, because you're going to have to count on spending more for your own health, and that for your family members. So another thing you need to lock in with providers you need now and in the future. You may need, if you have a significant health condition and you can afford it, you may want to consider a concierge doctor, because the best insurance in the world, it will not guarantee access to doctors in, say, 10 years from now. And I tell you, the other thing is that rural healthcare, the rural hospitals, they're getting hurt the worst. So reevaluate retirement choices as to where you live. I had a conversation with a nurse who's a client who is a nurse on and off with UT Southwest, one of the best hospital health systems in the country. They are jam-packed because they're finding people from other countries and from throughout the United States coming to them. So even though you have a great health system in your backyard, it's going to be, it may take you 6 months, as it did me, to get to see a primary care physician who could make recommendations to see specialists. So what can you do? Get healthier, live better, get checkups, stay on top of your health and make it a priority, and reprioritize your budget and your financial plan. 40% of doctors are retiring in 4 years. That's not like the far future. That's just around the corner. So I like this slide. This is all about economizing, making choices. How can you manage health and financial choices and financial risk through insurance choices? So now I'm going to talk about insurance and some of the concepts. We have what I refer to as a risk creep. The old Mark Twain story of you can throw a frog in a pot of boiling water and he jumps right out. Well, or you could put the frog in nice lukewarm water and slowly get it to boiling, and you kill the frog. And that's exactly what's happening with insurance. You've got higher out-of-pocket maximums, no out-of-network coverage on many plans, and with Medicare plans, you have separate drug deductibles. Now, example, I don't know about you, but if I were on a plan that had a $94.50 out-of-pocket maximum, and it was an HMO plan, and there's no coverage out of network, $94.50, that's less than 1 day in a hospital. That's a trip to emergency room. That's a couple of CT scans. It's very easy to hit that $94.50. So what happens? Are you going to be short-sighted and just not have that stuff done? Are you going to not travel out of your network, or risk being out of your network and facing that? And if you're on a Medicare Advantage plan, you would be a Medicare Advantage PPO plan. You'd be looking at $12,000 plus and out-of-network, out-of-pocket maximums. So, I get asked all the time, well, all I want is a catastrophic plan. Well, guess what? Everything is a catastrophic plan. There is no plan that isn't catastrophic. And there's no out-of-network coverage under Affordable Care Act plans, except for true life and death emergencies. And when that happens, it's balanced billing, which means you don't get the network discount. If you go to the emergency room, you're going to hit that out-of-pocket maximum. Boom. So how do you cover some of that risk creep? There are what are called indemnity plans that will pay a cash benefit for reduced financial medical risk at a super low cost. And it will also increase coverage for traveling. Once a year in the winter, I get a call from somebody who had a skiing accident and was out of network. And, they faced a big bill because they had to get their knee fixed and stabilized and move back to Dallas. And that when they get there and get the bill, they probably had to put it on a credit card to get it covered, but then they're facing a big bill. Well, this is how you can handle that. There are accident plans, very affordable, critical illness hospital indemnity plans. And then always compare the cost of your meds through your insurance with GoodRx discounts, GoodRx.com. And another one I want you to know about is CanadianMedStore.com. This is a Florida-based mail order pharmacy that for expensive meds like Januvia, Farxiga, many expensive medications that are patented, that are super expensive in the U.S., you could be saving a couple $100 per month on plans on medications through that store. So check them out, call them, find out how that works if it works for you. Now, $94.50 out-of-pocket maximum, out-of-network coverage. These are actual examples I ran about a year ago for a prototypical 40-year-old couple. An accident plan will cost a couple $16 a month. A critical illness plan for $10,000 for heart attack, cancer, stroke, $19 a month. And obviously, you've got a telemed or doc-in-a-box benefit with every plan embedded that it comes with the plan these days that can help, and can often prescribe medications. Another thing, don't trust a company brand name. Just because you had great plan with United Healthcare's group plan, whether it's an HMO plan or PPO plan or a Blue Cross Blue Shield. You love Blue Cross Blue Shield. Oh, it's such a great brand name. You see their billboards all around town. Well, that doesn't mean a thing when you're looking at individual plans, either Affordable Care Act plans or Medicare Advantage plans. There are also multiple networks from the same company, and each network has different doctors, different hospitals. Some will require what I refer to as gatekeeper referrals from a primary care physician you must see first before you can then schedule a specialist. And there's totally different member service levels. You may be talking to somebody who has been trained to say, no, you're not going to, if you call member services, you may have a long wait. Certainly get frustrated. I wish I had $1 for every time, for every minute or every hour I spent on hold waiting to talk to somebody in member services for a client. Now, here's another concept, multiple network shell game. Two companies, very great brand names, have as many as 6 networks with different premiums. And I'm convinced this is all to confuse price shoppers. The least expensive ones, you can go, your primary care is delivered only through telemed or a local clinic. And though at those clinics, they will rarely make referrals to specialists. They'll tell you differently, but that's really what's going on. And here's those of you that have are in sales, or maybe you don't, the adage that a confused mind buys on price. And that's exactly what happens with healthcare.gov. The navigators at healthcare.gov and every every call center, they are going to sell you on price and not bring up all this stuff or check your doctors or see, tell you what the differences are, because they know 90% of people are shopping on the basis of price. So how do you fight that? You can fight it to a certain degree. Whether it's me or somebody else, there are people that do this every day for a living and will check to see if your desired doctors are available in the available networks and plans. They may not be, but some of them are. And then you have to make a choice of which doctors are most important, which ones can you live without, and which ones do you need to change. But you need to do that now, and do that rather than wait till it becomes an emergency. You also don't have to be on the same plan, your family members, spouse, you and your spouse can be on different, kids. If you've got a college student in a different part of the state or country, then, besides student health plans available through some universities, you don't all have to be on the same plan. And you want to work with somebody that supports clients all around and isn't going to charge a fee. There are actually some that will try to charge a fee to do what they're supposed to be doing. Now, I'm going to talk for a second here about another option you may have thought about, but it's more important than ever in terms of reducing your risk and saving for out-of-network costs now and in the future. And that's high deductible health plans that are what are called health savings account or HSA eligible. First of all, you take a tax deduction on a contribution and use to pay for in or out of network medical, dental, or vision expenses. It's not a use it or lose it plan like an HRA. That money is your money forever. You don't have copays. You pay the network negotiated rate, but your wellness visits are still free. And even though your cash flow may be low, you may still want to consider making a contribution to a health savings account. Here's what this was published a couple of months ago. For 2024, an individual can contribute $4,150, a family $8,300, and then if you're over 55, which I'm not, of course, you can contribute another $1,000, either individual or family. And so this is a great way to put money aside. It continues to grow tax-free. You take a tax deduction, but rather than 9450 out of network coverage, the highest calendar year out of pocket maximum is 9450 for plans to the Affordable Care Act. It's only 8,050. It doesn't sound like much, but that's 20% less. And the maximum for family is 16,100. Some plans are unlimited out of network. So there is a benefit to reducing risk as well as the tax benefit here. Now, I'm going to talk about premium tax credits and cost sharing subsidies. This is based on your income. It determines how much you pay for individual insurance. And unlike in other countries, how much you use your insurance has no bearing on what you pay for insurance. It's all based on your household size, and I wanted to define that as the people that you plan to put on your tax return on 2024. So if it's a couple, it's two kids, one is over age 26 and on their own, it's a household of three, if you're married, etc. It has nothing to do with how much you use insurance. So it's based on this. Now, within these, you can finesse your estimates to maximize your cost sharing, premium subsidies, and access to the Texas Children's Health Insurance Program for children under the age of 19. So at worst case, it's an interest-free loan. I'm going to give you an example. This is the federal poverty limit for 2024. And in Texas, we did not expand Medicaid. So if you're a single person, $1 less than this amount, and you're not eligible for a tax credit. You can still purchase insurance, but you're going to pay the full amount. But if you estimate 14,580, your insurance will be super cheap. And if you select a silver plan, your out-of-pocket expenses, meaning co-pays, deductibles, and co-insurance, it's going to be very affordable. You're going to have to manage through the ins and outs of no out-of-network coverage and possibly an HMO plan, but all of a sudden it becomes affordable. The subsidy of your out-of-pocket expenses is referred to as cost sharing. It's for anybody that is there's certain amounts of cost sharing if your income estimate for 2024 is below 150% of the federal poverty level. And then this is a sliding scale. At 400% of the federal poverty level, there is no subsidy. So 58,320, you may get $1 worth of premium tax credit, but you don't get any at 58,321. Follow? Now I'm going to give an example. Here's a single woman, age 35, household income of 15,580. She would qualify for a $427 per month premium tax credit and a cost sharing reduction, a subsidy or out-of-pocket expenses. If she selected a silver plan, she could actually find a plan that doesn't cost $1. But look, you still have $94.50 here. Okay, and if you're doing this yourself, or you're working, at healthcare.gov, or you're calling healthcare.gov, or a call center, they're going to slam you into the least expensive thing, regardless of or really explaining all this. And it's real easy not to know this stuff. But if you selected a silver plan, and again, this is zip code 75204 in downtown Dallas, but you can do this in any zip code, and zip code and county related. Same person, 34-year-old woman, could get a silver plan, and instead of a $94.50 out-of-pocket maximum, her out-of-pocket maximum for selecting silver plan would be $1,800, and possibly paying as little as $5 for specialist visits and doctor's visits. I'm going to use a second example to show you what the impact of CHIP is. Texas Children's Health Insurance Plan. This single woman now has a daughter, age 16, which is under the age of 19, obviously. The household income is $19,750, which is the minimum income for premium tax credit. And because she is going to select a silver plan, let me show you what happens. Well, first of all, let me go back to this slide. What happens is this child, her application will go to Texas Children's Health Insurance Program, otherwise known as Texas Medicaid, and she will most likely be approved. If she isn't approved, then she can be added to the mother's plan retroactive to the first of the year in this case. So I want to talk about that for a second. So here's the same plans. If she selects a bronze plan, again, this is only covering the same person. She can get the silver plan for as low as $0. The children's health insurance plan, you can go to yourtexasbenefits.com is the easiest place, and then go to apply for benefits, and you'll see all the different plans here for Chip under the age of 19. Click on the click on the middle button, healthcare. You don't need to do this, but it's very interesting to see what it's going to cost. It's super, super affordable. And it is designed to help, because children have, if you can keep children in the healthcare system and healthy, it makes a huge difference as they get older. And then you will also be redirected then to the Texas Health and Human Services Department. It will go into more information, tell you what it costs. Now, the federal income tax brackets were published early last week. This is about a week old. And this is for a prototypical 50-year-old individual and a 50-year-old couple. Okay, $14,588 and $19,750. The federal income tax at that level is $1,475, and it's payable in April 2015. For a couple, it's $2,370, payable in April 15. That's assuming they don't have any tax deductions or anything like that. This is just the income tax here. But the value of that premium tax credit, that's $7,500 a year, $7,488. For a couple, it's $14,976. And then if you select a silver plan, you get the benefit of very low risk. Yeah, you have to deal with the HMO, but there's no excuses anymore. There's no excuses for not having coverage. I'm sorry. People that are looking to buy cheap, I spent probably 3 hours with somebody over the course of Sunday night to Monday who wouldn't accept that these are the best plans because they were looking for something that was less expensive or less risk. But this is what's available. It doesn't matter whether it's a individual plan or a group employer plan. You're going to have to deal with all these issues. That's why I'm bringing it up. Healthcare.gov plans and CHIP Medicaid plans for children, they protect you from extensive catastrophic health risks at affordable and no cost. And you can reduce some of that out-of-pocket risk if you select a silver plan and you're eligible for cost sharing. It'll reduce it, but if you don't qualify for the cost sharing, you can reduce it with an indemnity plan. So at worst, if you end up making more than you estimate, you have to pay some of the tax credit back for the months that you were on the plan. And you do that in April of 2015. But in a job search, if you plan on getting back, with an employer with the health plan, you have income coming in, at some point you're going to have to pay that back, but it's April of 2015. So at worst, there's no penalty for underestimating your income. But you have to realize it's kind of like an interest-free loan, because how much of that tax credit you actually get to keep is based on your actual income. But at best, it could save a loved one's life by having somebody covered. And by discovering an unknown or through a diagnosis from a wellness checkup, finding something really life-threatening. And I've over 20 years, I can in my sleep, I could close my eyes, I could think of so many examples. So I want to tell you, more important than your premiums is reducing your risk. Don't be cheap. Don't let your spouse make cheap decisions. You have to think about risk in addition to what it costs, and access to doctors and hospitals is going to be more and more important. I gave you some examples of how to control meds costs. Always compare the cost of meds from a copay with what it would cost at GoodRx or Canadian Med Store if you're on some super expensive patented medication, and see what you can do to cover risk when you're out of network. Also, I write a lot of business for people, very affordable coverage for people that go on cruises or go out of the country. I myself spent 6 weeks in Mexico learning about their healthcare system and learned so much in this spring and summer. It's like $100 for a 3 week, 3 weeks, or $100 for 4 weeks of coverage. And it's just, you got to think about risk. Now, the dates for open enrollment are November 1st to 15th. They have coverage by the 1st, January 15th for February 1st. Then you have all kinds of special enrollment periods. This one is interesting. If your income estimate is less than 150% of the federal poverty level, you can change your plans at any point during the year. You can go from if you found you should have been in a silver plan because you're eligible for cost sharing, you can take advantage of this special enrollment period. And then obviously the stuff that is typical, you'd probably come across. Now, one more thing, this year there are all kinds of new regulations that you must do. There is now a form that you must sign and date and complete prior to enrollment if you're under age 65, and there's even more regulations on the Medicare side. So this is something I can send you the form, but I've also created what I refer to as an intake form. And this is important because probably 95% of the people I talk to, they don't have this. They don't have on a document that tells them who their key doctors and hospitals and meds are and types of doctors. And the older you get, and as more doctors retire, this is going to be so important. But this gives me everything that you need. And then next year, I'll just be able to send you, then we'll just be talking about updates, and it'll save you time and me time, and it gives me everything I need to do all the homework for you. But sooner or later, you or your spouse or your children, you're going to need a new doctor, a specialist, or access to a hospital. But I'm going to have this rich database as people fill this out that I'll be able to, I can now from memory, but I want to make this available so if people need to find specialists, I can recommend doctors that I know that enough patients have used that this is a legitimate doctor. And then more and more with cyber bad guys hacking email addresses, I've gone to a secure file transfer that encrypts everything, encrypted database. And the link is in my signature file, and you just upload that, and then I get your form and the form that you have to complete to enroll at healthcare.gov. If you want, I can send this to you. Again, you can't enroll without signing the form, and you get at least a half hour of my time researching your doctors and hospitals, see which one is in network and which ones aren't, and help you make a knowing decision. And because this is required, I'm working on those that get the form back to me first. And then once I get the form, I can send you proposals and a calendar reminder. Now you're 20, this is not forever. Okay. So every year it changes. You have to re-enroll for the premium tax credit and cost sharing subsidy. 2025 plans will be different. But I get asked, well, isn't there something? Can I get an individual plan that isn't an Obamacare plan? No, not that covers any pre-existing conditions. And you may not be eligible if your height and weight isn't right, and why would you want to, except for maybe coverage for a month and until you're going to be eligible for an employer plan because you've got a job coming up. You don't want any other. This is it. It covers all the wellness benefits. I'm going to talk a minute about Medicare and go through this fairly fast. And I'm recording this too, so Alvin's going to have the link to send out, so you can go back through this, stop it, or share it with people. Medicare open enrollment period, October 15th to December 7th. So I'm in the midst of that too. If you want to make changes and you're on a Medicare Advantage plan, you can do that January 1st to March 31st. Medicare A and B, those of you that aren't on Medicare may be interested in this because sooner or later you will. Part A, hospitalization, hospice, and some blood transfusion. If you or your spouse has worked 10 years or 40 quarters, then you have paid into original Medicare Part A. It's no quota. It's not free. You pay for it. And then Part B is what's referred to as doctor coverage. And the Part B you do pay for, that's this year is $174.70 per month. But if your income is over certain brackets, you can Google IRMA taxes and find the brackets for yourself. You see how much tax gets added to this $174.70 amount every month. And that's individual. Medicare is always individual. So if you and your spouse have a household income about a certain amount, you're both hit 65 and you're eligible for B, you both be assessed that. You'll each be assessed that IRMA tax. Now, A and B cover 80% of medical expenses, but there's no, there's ad infinitum and no meds. So, but with A and B, you can see any doctor or any hospital in the entire country that accepts Medicare, and 95% of doctors and almost all hospitals accept Medicare. Eventually, though, if all you have is Part A and Part B, you'll go broke, okay? Because sooner or later, you or your spouse will have a serious life-threatening expense, and you will spend, 20% can be a real big number. So what you do, and also there's no drug coverage here. If you don't purchase drug coverage, then you'll be assessed a penalty, which will work out for about $1.25 per month for every month that you don't have drug coverage. You can purchase private insurance to reduce the medical expense and reduce the cost of your meds. You are eligible the first of your 65th birthday month, unless you're born on the first of the month and then it's the month before. You can roll 3 months before. You can also stay on an employer plan, okay, if you're going to work past 65 and stay on employer plan. You don't need to sign up for Part B. You can stay on the employer plan. And then when you do terminate from the employer, you have 60 days from loss of coverage to enroll in Part B. So you enroll in Part A, though, you need to enroll in Part A Medicare if you continue to work past 65, because if your employer health plan audits the claims, you have a big claim. This happens tragically about once a year with a client. If you work past 65 but didn't sign up for Part A, the employer's health plan can audit, if it comes up in a audit, they can send you a bill for the expenses that went into the group health plan that you should have, you're responsible for since you didn't sign up for Part A at 65. But usually Medicare Part A and B and supplemental coverage will have much lower risk and will be more affordable than any employer plan. I'm going to talk about special enrollment periods, but I could take all day. There's tons of them. Blizzard, heat, this summer there was a federal emergency in Texas, drought, loss of a group health plan, Medicaid, loss of eligibility, moving from one state to another. Those are all special enrollment periods. Now, I'm going to talk about this for 2024. There's now for the first time, a cap on prescription expenses to $8,000 in 2024. I talked about separate drug deductible, drug expenses under Medicare. They're finally starting to tame some of this. That moves to $2,000 in 2025. And then there's expanded benefits for those that are Medicaid eligible. Now, agent compliance. This is important because this has added a ton of time for agents. There is a form called a scope of appointment now this year for the first time. We have to wait 2 days to enroll, and then all enrollments must now be recorded, and we have to follow a script, and that's adding about an hour and a half per enrollment for Medicare, which I gladly do. Other important things, they're what are called Part B give back plans that will have reduced benefits, but will pay back a portion of the $170.70 in Part B. You also have what are called Medicare supplement lookalike plans that are Medicare Advantage plans that will act like a Medicare supplement plan at a lower cost, which would make sense for people that are in their 80s and 90s. Perhaps you have a parent that's been on a Medicare supplement plan forever and are in their 90s, and they're probably paying $400+ per year. Well, this is not option. There's also, thankfully, a clampdown on celebrity advertising and telemarketing calls, but they can't go after all the offshore call centers. I get them. They drive me nuts because they're all designed to get you to give them your information so they can sell you something. And then CMS is trying to negotiate high-cost drug pricing. We'll see if that's successful next year. There's a call recording and disclaimer. The disclaimer must be communicated. And I have to, I'm going to say this now. I do not offer every plan in your area. Any information I provide is limited to those plans I offer in your area. Please contact blah, blah, blah. And I represent just about any Medicare company in Texas and most in 14 other states. So I spend probably 4 months of the year going back through and recertifying every year with every carrier. So that's it. I've met 2024 healthcare and insurance options regardless of age. I know I went fast and I can see there's 15 chat things here, but please know you can reach me. Because it's open enrollment period, I'm normally a first ring guy, and I've been doing it for 20 years. And I have to, right now, I have to realize that voicemail is there for a reason so I can get some work done for clients. So you'll probably hit my voicemail, but I'll return calls as soon as I get a break from, from being able to keep up with the workflow. And the best way to start is a 5-minute call or text. And then you complete and return the form I'm going to send you. We'll talk and go through some of the stuff, but I'm going to record this. So if I went too fast, you have questions, feel free to go back through this. I'm going to send this out and I'll have it on YouTube. The best thing is to call or text me. People want to send me email. I may read an email like at 3 a.m. the next day. Okay. And LinkedIn messages, I can't keep up with LinkedIn messages. I get so many LinkedIn messages from people who obviously haven't read my profile that are trying to sell me SEO services or this or that. I even get proposition from supposedly from fake profiles from all over the world, and it's just disgusting. So it may be once a week I delete those and I connect with people that are legitimate. So this is all no cost to you, expertise. I support my clients year round. I'll help you save money, save time, reduce risk, avoid mistakes. I've just scratched the surface on strategies, but the key thing is focus on your job search. That's what you're good at, and your skills and your your training is what you're good at. Don't try to waste your time on this stuff. And the other thing is focus on access to your doctors and hospitals and meds, and get caught up, especially guys, get caught up on all your wellness exams. Okay, so that's it. I thank you for your time. I really, I hope you understand that I'm passionate about this. I love doing this. I feel that this is, after a 25 plus year corporate career as a rat think, I'm able to provide true value to the community in Dallas Fort Worth and in throughout Texas and other states. And I thank you. God bless you. Thank you for hanging in there, and I will answer questions.
Okay, Mike, we've had a few questions in the chat. Let me run through a few, and
Yeah,
please chime in,
please.
whoever asked these questions, if you needed more clarification. The first question I have is about Amazon Healthcare. Someone wants to know if it's a real thing or it's just, talk.
Well, Amazon has grown so big, as has Facebook, as has Google. They're running out of, to keep their growth going, they're running out of markets that they can dominate. And so healthcare has always been of interest. And I really feel Amazon is going to be a player. They're offering, they have a clinic in Dallas Fort Worth that their associates working in the warehouses, whatnot. There's in the dark robot warehouses. There's still some people in there. Those people can use the clinics, and they just, I think a week ago, started offering it to people. It's not insurance. They have Amazon Pharmacy, and that's another thing, kind of like GoodRx. You can go to Amazon and check it out, but shop and compare. It's not going to give you access to doctors and hospitals. It would give you access to a telemed benefit, but here it's a niche player now, but I look for them to be a bigger player. Another one is Aetna CVS, and all of their drugstores. One of my sons is a career manager for CVS, and they are developing health plans and have health plans that, in addition to telemed, they will provide document boxes in CVS stores, and more are converting those drugstores into retail clinics because they see the same retirement of doctors and not enough to go around and increase the demand. They see that as one of the solutions that they can offer Aetna health plan, branded health plans, that people's primary care would be, and possibly specialists would be, through retail clinics. So yeah, I see Amazon and Aetna and Google as players long term. Then they got big pockets to spend, so they're going to try a lot of different things. Alexa is going to have a place in this, Amazon Alexa. So it's the world is changing really fast.
Okay, thanks. I appreciate that. We also had I think you may have answered this question about the examples you've given. They're all from the insurance marketplace, right? They're not private insurance.
Yeah, as an individual, don't even, other than if you need coverage like from December 1st to January 1st, you can get excuse me, a short-term health plan. It's not going to save you money, but your income estimate may be higher this year than next year. So it may save you a little bit of money, but it will not cover pre-existing conditions. you have a super high out-of-pocket maximum, but it'll cover you for 30 days. And, that's and no copays, no, no wellness benefits, and they will deny you if your weight is out of line or if you have pre-existing conditions, or they'll just, so it's limited, but that's the only place. So don't waste your time even looking for something else. That's it.
Okay. Let's see. I know you touched on this about the Medicare, but
Mhm.
let me ask this question to make sure that's been fully touched on. Is it if you are on your employer's medical plan or coverage and turn 65 during a year, what happens? Do you
Well,
continue to pay both the employer plan and the Medicare, et cetera?
no, and turning 65, or rather going on to Medicare Part B, that is a special enrollment period. Whether you're 65 or 67, 70, when you enroll in Part B, that is a special enrollment period where you can disenroll from your employer health plan. Now, Part A, again, you have to work the 10 years, 40 quarters. A is no cost. You want to do that at age 65, or you have a risk there that the employer health plan won't cover it because you are past 65. So you get a Medicare card with Part A on it. When you enroll in Part B, you want to disenroll from the company plan. You don't pay for both. So you want to do one or the other. And the best time to do that, because they're all calendar year deductibles, the best time to coordinate or time that, if you voluntarily want to leave an employer's health plan, is effective the first year. If you're involuntarily terminated from an employer's health plan past age 65, then you want to sign up for Part B, and not Cobra, because Cobra is not qualifying coverage past 65. So you want to sign up for B and go on to, so you have original Medicare Part A and Part B. You get a new Medicare card, red, white, and blue card that lists A, lists B, and the dates you're eligible. And then you sign up for supplemental drug and medical coverage.
Okay. And there's a part to this. It's about the spouse. If your spouse is 65 and you obtain an employer coverage, should you put your spouse on their plan or have them continue with Medicare?
Well, in some ways, that's based on cost. Usually, these days, an employer health plan for a dependent or a spouse, there's no employer subsidy. You're going to pay the full amount for the spouse. So usually, unless you are subject to very high IRMA tax, Medicare is going to be less expensive, and it's definitely going to be better coverage, because you can see any doctor with a Medicare Part A and B and a Medicare supplement and a Part D plan. Your only out-of-pocket medical expense risk is $240 for the entire year, and you can see any doctor anywhere in the country. And that'll run for somebody age 65 to 67. That'll run about $320, maybe a little bit less for a woman. Women have less claims at our age, so that's reflected in the cost. And usually an employer's health plan is going to be more expensive, and I can guarantee you their out-of-pocket medical expense risk will be higher. So unless you're a high wage earner and are subject to like $500 of IRMA taxes each, then Medicare is going to be the economical choice, as well as being the choice with less drug and medical risk.
Okay. Well, you're shaking some things loose. I got another Medicare question. This person says, since I have to work till 67, do I have to wait for Medicare till 67, or can they do it at 65?
Question. You can't enroll in Medicare. It doesn't go into effect until your 65th birthday. So you don't have to stay on the employer's plan. It's a qualifying event. You want to sign up for at least Part A, but you probably are going to want to sign up for Part A and Part B, And you can sign up 3 months before the first of your 65th birthday month, or the month before that if you're born on the first of the year.
Okay. Let's see where we got. Let's see. Got a couple more questions. Somebody wants to know what's the reasoning behind the 2-day waiting period?
Oh boy, I wish I knew. Back in the day, it was worse. And this is way pre-COVID. You would have to go to somebody's house, and this is before internet, and the cell phones were like get smartphones. You would have to show up at somebody's house and get them to sign a form, and then you were allowed to come back 3 days later. And part of the reasoning, which I don't buy, but part of the original reasoning was because there were unscrupulous agents that were going into nursing homes and memory care centers and just getting people to, oh, show me your medical, and signing them up. And it was, and maybe, the power of attorney or the spouse would come by. What did you do? Well, this person, so it's designed to kind of give it was originally designed to get get kind of like a sanity check for the person enrolling. But it is now, at least it's done virtually, but it's still a pain, because I can guarantee you from December 1st to December, it's like paying your taxes. Most people start thinking about it after Thanksgiving. So Medicare beneficiaries, because their open enrollment date ends on December 7th, after Thanksgiving, boy, they're gonna be calling, and I'm gonna say, hey, you gotta fill out this form and you gotta send it to me, and I need your names of doctors and your prescriptions, and they panic. So just I've warned clients, you got to do this more often to be able to do that. I want to go back to also something too. If you are age 65, have you ever encountered, or 55, if you ever encountered, especially with a young 30-something hotshot, or think they're a hotshot recruiter, have you ever experienced age discrimination? Maybe. Yeah, of course you have. That's a fact of life. They look you over. They want to see you. They want to make sure that you don't you're not going to be a heart attack waiting to happen, and you have medical claims on their employer health, self-funded health plan. So age discrimination exists, and actually telling somebody, being upfront and saying, look, I'm on Medicare, you don't have to pay for, I'm not going to be on your health plan. An employer oftentimes, and the recruiter may not be aware of that, the employer is the hiring manager or the HR manager is like, well, we don't have to take as much of a risk on claims, because they watch the claims. We don't have to take as much of a risk with this candidate because they're on Medicare. They're not going to join our health plan. So yeah, maybe that works in your favor on you versus another candidate who is just as talented, same amount of skills, blah, blah, blah. It happens.
Okay, well, thanks for sharing that with us. Let's see, I think I got one more question. Something has to do with, you mentioned April 2015 several times. Was that just an example, or that's something special?
Well, that's when you should be paying your taxes unless you file delay. So,
Well, you specifically mentioned 2015, like the year 2015.
Okay, good point.
Okay.
You estimate your income for 2024. If you end up making more money, and hopefully you do, right? You still want to make more money. If you end up making more money, then you have to pay some of that premium tax credit back for the months that you were on the plan. But you don't pay that. You get a tax form from the insurance company called a 1095-A that you submit with your taxes. And that's when the reconciliation occurs between what you estimated and what you actually earned for the year. And then you either pay some of that premium tax credit back, or if you earned less, which hopefully won't happen, you will then get a tax credit that you can use to pay your taxes.
Okay. So, any more questions?
Yes, I have a quick
Gee,
question.
yes.
I hear you saying often that Medicare Part A and B and supplemental. Do you have a favor over supplemental over Advantage plans?
Great
And
question. I'm sorry, I cut you off.
yeah, say that again.
You had another question coming, but I cut you off by saying
Oh
great
yeah,
question.
my question is, I've been doing a lot of research on trying to understand what supplemental plan is and what Advantage plan is, because that's what you see on TV a lot right now. And I have friends that are telling me Advantage plan, there's limitations, there's caps, and there's the approval that you have to have when you want any kind of a treatment, versus supplemental is just like a mega, it's like a gap coverage. So my question is, do you favor supplemental plan over Advantage plan? Because that was totally a game changer for me, because I thought Advantage plan was better.
Well,
But
that's because all the advertising you're seeing is for Advantage plans, right?
Exactly. And I'm learning they are not, because I'm learning that that's more catastrophic if we went with that, because I need my husband to be able to go any PPO where any doctors that he wants to see or need to see. And it sounded like Advantage plan has a lot more limitations versus supplemental. If we had just regular Part A and B and supplemental, do you agree with that?
Well, first let me say, why don't you send me an email
Okay.
asking for my Medicare Unplugged email, and it's excruciating. It's long. It goes into exactly the pluses and minuses of both, and where you sign up for Part A and Part B, a specific way you do it if you're past 65 and leaving an employer plan, or which require different forms, and a link to enroll it on the Social Security website. So, but generally, it's apples and oranges. 60% of over 50% of plans today are Medicare Advantage plans. And the system, quote unquote, the system favors Medicare Advantage plans. CMS, Center for Medicare Services, they know they have to ration healthcare. The insurance companies make a boatload of money. That's why they spend so much money on advertising, and and brokers love to sell them because they make a lot more money on Medicare Advantage plans. Right. I will go to great length to educate people of the pluses and minuses. A Medicare supplement plan will cost, at age 60, when you first enroll in Part B, first of all, you don't have to answer medical questions. After that, then you do have to answer medical questions if you want to enroll in a Medicare supplement plan. At some point in your 80s and 90s, that Medicare supplement plan that costs maybe $120, at age 65, it may cost $400 a month, and that may either be not affordable, or you're no longer traveling, or you've had enough. But I can tell you myself, from my own experience, and I don't mind telling him over 65, although I'm sure you think I'm age 40, maybe 45, but myself, I selected a Medicare supplement plan. And there's no difference between one company's Medicare supplement plan or another's with the same letter. Their benefits are standardized. So the only thing that matters is how much you pay and how quickly the insurance company raises the premiums as you get older. Some companies that are very large, that have the color of blue, and there's more than one in their logo,
Mhm.
they are notorious for raising their premiums faster than other companies. So if you enroll in that company, then you're stuck if you have a health condition or develop one.
Mhm.
And you may be unhappy with the broker that sold it to you. So you've got to know these things. I can tell you personally that I am so fortunate that I selected a Medicare supplement plan because I have got, let's just say I've got my money's worth
You have
because
a
of
G?
pardon
You
me.
have you have a supplement plan G
Yeah, I
or
could
N?
have
Okay.
purchased the plan F, but I selected plan G.
Okay.
And my only out-of-pocket medical expense was for the calendar year next year is $240. So the first or second time I go to the doctor, and I can see any doctor in the country, um, you know, I've met that calendar year deductible, and anything that is approved by Center for Medicare Services, which is pretty much anything but cosmetic surgery and stuff like that. Imaging, it's covered. So it's a great deal. And you can
Thank
only get that without answering health
Question.
conditions under your age 65. But
I,
ask for the email Medicare Unplugged, and I'll send you more.
Medicare Unplugged. I definitely will send you email on that. I held off putting him in Medicare because I thought it's just our regular insurance is better. But like you said earlier, it would be so much cheaper for us if I go ahead and put him in Medicare because he has disability. So I can't put it off anymore since I'm unemployed, and it'd be better for me to go ahead and get him off Cobra and put him in regular Medicare that he is eligible for. So
Is he past age 65?
no, he's same age as I am. Oh, I mean, I don't want to say I am. He's 57. I'm 45.
Okay, well, you can, if he's been disabled and collecting, if he's applied for Social Security
He
disability
gets
income,
SSI. Yes, he
then
does.
after 24 months, he would be eligible for a Medicare Advantage plan until he turns 65. And I'll answer all those kind of questions.
Sure. Thank you. Thank you very
Sure,
much.
you bet.
One other quick question is, do you also do regular health insurance? I think earlier you were showing us those insurance that was in the marketplace. You do regular insurance for myself and my daughter, right? Like whatever health plan there is out there. I don't want Obamacare, but I'm just asking regular health insurance for us.
You just asked the $64,000 question.
Oh, sorry. If it's too long, we can wait on that.
No, it's all right. I get asked all the time that question. I say, "Oh, you're looking for the unicorn plan."
Oh,
What do you
okay.
mean? What do you mean? Well, the unicorn plan it's not Obamacare. It's something that's better.
Okay.
That's affordable and blah blah blah, and has a PPO and all that. There's no such thing. You have
Okay.
Obamacare. And even employer plans are governed by Obamacare, but there are no other plans that will cover any and all pre-existing conditions and will cover you and provide wellness, etc. You may want to consider a short-term plan that will exclude all kinds of things for a 30-day period, but don't be sold by some some fly-by-night company that there's something better that because it doesn't exist. You're wasting your time or you're going to be scammed.
All right. Thank you, sir.
Sure.
Appreciate it.
Thanks, Key. Okay, well, Mike, thank you very much. I appreciate you taking the time to answer our questions.
My pleasure. Thank you so much.
And I'd go ahead and direct everybody. If you have further questions, please go ahead and contact Mike. His contact information is right here on the screen. And Mike will be sharing the recording of this, so I'll go ahead and send it out with everybody who's checked in. So please go ahead and do that. Mike, anything else before we drop off?
All set. Thanks so much for the opportunity. I really look forward to it. It's been a great morning. You made my morning and day. Thank you.
Thanks, Mike. Okay, everybody, just want to remind everybody there is an HR meeting that's happening right now. I dropped a link into the chat, so you go ahead and click on that and join that. Also, I'll remind you the Southlake Focus Group meets tomorrow morning at 8 o'clock, both online and in person. So you can get some more information from southlakefocusgroup.com on the internet. And again, thank you very much for joining us. One more thing, next Wednesday, we will not be meeting. That's the day before Thanksgiving. Okay, everybody, thank you very much. I'm going to go ahead and shut this down. Mike, thanks again for joining us.
Hang on a second. Hey, Key, do you have my cell phone number?
I don't have your cell number.
It's 920
920.
664
Okay.
5185.
5185. Okay.
Call me as soon as you get a chance.
Okay, Joe, let me get on the HR meeting and then I'll call you right after.
Oh, HR's next?
Yes.
All right, well, let me log in there. Okay, bye,
Okay.
guys.
I'll talk to you afterwards. Thank you.
Sure.
I just
Thank
dropped
you
the
very
link
much.
back in the chat again. So it's back in there.
Thank
Okay.
you.
Bye-bye.
Bye, everyone. Take care. There we go.